Hello, everyone. And on behalf of the team at the Australian Institute of Architects, I'd like to offer you a warm welcome to today's Lean In, which is an introduction to trauma-informed care. My name is Daniel Moore, and I'm the State Manager of the Victorian chapter at the Australian Institute of Architects. And it's my honour to be your host and moderator for today's Lean In session. We acknowledge with deep respect the traditional owners of this land from across the country that we are gathered on today. We acknowledge that it is a privilege to stand on country and walk in the footsteps of those before us, and we pay our respects to elders past, present, and emerging. Today's Lean In session is being recorded, so if you miss anything today or have to leave early, we'll be publishing this recording on the Institute's YouTube channel in the next couple of days, and we'll share that link with you in our upcoming email communications. This Lean In session enables you to ask questions of our panelists. So if you have any questions or a comment, please use the Q&A box down below and you can add yours. And throughout this session today, we're going to do something a little bit different. I will actually be asking the questions as they come in, and I'll try to interrupt the speaker as little as possible. So please put your questions into the Q&A box at the bottom of the screen and we can ask them along the way. Today's session on trauma-informed care features Dr. Anna Wolfe, who is a clinical psychologist and PhD from Phoenix, Australia. Anna is a clinical psychologist and research fellow at Phoenix, Australia. She has worked as a clinician for over 10 years across various public and private hospitals and not-for-profit organisations. She has also conducted post-doctoral research at the University of Melbourne. Anna currently works in Phoenix, Australia's training and workforce development team. Using both her clinical and research background, she provides specialist trauma-focused education and training to various organisations, health professionals, and the public. Now, the Institute recently partnered with Phoenix Australia, who deliver a trauma-informed care CPD package. This package is a new requirement for members who participate in the Architects Assist program. We introduced this to minimise the risk of adding to the trauma that clients may have experienced in connection to their architectural projects. Architects engaged by people impacted by natural disasters recall the additional care required to deliver architectural services sensitively. We hope with this training you can continue to deliver great outcomes with high client satisfaction. So now I'll hand over to Dr. Anna Wolfe. Welcome to our Lean In. Great to have you with us. I'll now hand over to you, and thank you so much for joining us in Melbourne.
Thanks, Daniel, and thanks to everyone for joining us today or listening to the recording. So today is an introduction to what's called trauma-informed care, and it's really just a little bit of a taster of what trauma-informed care is. You will be asked down the track to be completing an online training course as well. So this is just a little bit of a prelude to that. As Daniel mentioned, we'll be going through, how this might be supporting your practice, and in particular, starting to think about how you can use this in your work with people who've experienced disaster, but also more broadly with people who've experienced trauma. So today's session is going to go for about 45 minutes. Up to an hour with some questions. I've just spoken to Daniel, and as he said, I'm happy to take some questions throughout. So I hope you find it useful. I do also want to acknowledge the traditional owners of the lands on which we meet today. For me, it's the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present, and emerging. Just a little bit about Phoenix, Australia. So as Daniel mentioned, AIA are partnering with Phoenix, Australia, and we're Australia's Centre for Excellence for Post-Traumatic Mental Health. We've been operating for over 25 years, and we're an independent, not-for-profit organisation and a registered charity, and we have an affiliation with Melbourne University. Daniel's very kindly given a very nice introduction to me. So yes, as I said, and as he said, my name's Dr. Anna Wolfe, and I'm really pleased to be with you today. Before we get started, just want to highlight that by the very nature of the topic today, trauma will be discussed. And, this discussion can be unsettling for some people. So do take time out if you need to, either from today's session or, down the track. Seek supervision or support if you need to, if your distress is continuing. And of course, you've got your organisation's EAP service, perhaps your GP or your psychologist, and also these phone or web-based supports as well. So, as we've mentioned, today's session is really just a brief overview of trauma-informed care, or TIC. But today's session really isn't designed to fully equip you to implement TIC. It's really the online self-paced course that will give you much more knowledge and skills to be able to put it into practice. So what is TIC? We've mentioned it a number of times already today, but what is it? Trauma-informed care is actually a topic that organisations are increasingly talking about, and quite rightly so. Historically, it was introduced in the healthcare sector, but it's recognised much more in other organisations, particularly in organisations where there's a high likelihood of working with people who've experienced trauma. And what exactly is it? Well, it's about an understanding of the impacts of trauma, how people present. It supports employee well-being and also guides the implementation of policies and procedures and interactions with service users. So really, it's applied at both an organisational level, but also at a worker level. And it's the approach to providing this, I guess, your existing services. So it's not a particular treatment. Importantly, it's informed by research and by practice knowledge, and also by the input of trauma survivors themselves. Now, this definition here is a fairly well-established definition. So I'm just going to go through that now. Trauma-informed care is a strengths-based framework that's grounded in an understanding of and responsiveness to the impacts of trauma. And it really emphasises the physical, psychological, and emotional safety for both providers, but also the survivors that you're working with. And it creates opportunities for survivors to rebuild a sense of control and empowerment. So there is a fair bit to kind of unpack there, but as we go through today and as you go through the online course, that will become a bit clearer. In terms of the aims of trauma-informed care, really there are 4 kind of broad aims. The first is to minimise trauma-related barriers to accessing and engaging with services. So, for example, providing information and services that might help survivors feel in control of their recovery and feel supported if they choose to disclose a trauma. Or maybe, in the case of disaster, talking about the disaster that they've been through. It's about minimising potential harms from service delivery. So, for example, ensuring that systems or environmental cues and practices don't inadvertently remind people of their trauma. It's about providing services that support hope and self-determination, so people have a better chance at engaging with organisations or your organisation and cope with or recover from the impacts of trauma. And finally, as was mentioned in the definition we just saw, it's really to also support provider safety. So whether it's physical safety, whether it's psychological safety. And so, workers can feel safer in the workplace, but also then in turn can be more responsive to the needs of clients. I guess taking another further step back, we're talking about trauma-informed care, but what exactly is trauma? Trauma is actually a fairly inconsistently used term within the mental health literature. So sometimes it's used to refer to an event, and other times to describe the psychological injury arising from the event. here we often, will talk about, particularly today, we'll be talking about trauma as a psychological wound or injury, and then talking about the event itself as a potentially traumatic event. So this is really to kind of capture the idea that a range of different trauma events can be traumatic, and what's traumatic for one person might not be traumatic for the other. So events are potentially traumatic. I'm going to throw a question out to you now. What do you think are the features of an event that might contribute to it being traumatic? So, what aspects of an event might be traumatic? In particular, I don't necessarily mean to label, bushfires or floods or what have you, but what are the features of those events that might make it traumatic? Does anyone want to add anything to the Q&A chat? I think we're getting loss of sense of place, Sigrid, thank you. And Kylie is talking about a change to the regular routine of life. Yeah, sure, absolutely. These things are most definitely part of it. Chloe, yes, absolutely. Overwhelming and perceived threat. So I think that's really a huge part of what can contribute to something being traumatic. So, that overwhelm, that though it's often associated with feelings of really intense feelings of fear, of helplessness, of powerlessness. In particular, it's often in relation to death, so exposure to death or threat of death, or actual or threatened serious injury, actual or threatened sexual violence. It can be sudden and unexpected, but also it might be prolonged and intense. That's particularly the case with sort of interpersonal abuse. It might be single events or repeated over time. And all these things, they might be witnessed directly, they might be witnessed, or you might learn about them from a close friend or a relative. Also, I guess importantly in the work that you're doing, you might get repeated exposure to written material or visual material or hearing stories about traumatic events as a part of your job. And that can in turn have vicarious trauma. So that's secondary trauma. So really that's where you might be experiencing some of those same symptoms that the people who have experienced that trauma directly might have. I guess it's also important to really recognize that trauma is common. Up to 75% of Australians have experienced at least one potentially traumatic event in their life, and most reporting 2 or more. And more than 2/3 of exposure to traumatic events or a potentially traumatic event might occur before the age of 16. So again, thinking and throwing another question out to you just to kind of get you thinking is, what kinds of impacts might you observe in the people that you're working with, or maybe even your colleagues? What might you see as a result of someone experiencing trauma? What does it look like? Does anyone want to add any oh, it's increased anxiety? Thank you. Despair, lack of confidence is another one. Thanks, Isaac. Angry emotions, blame, anxiety, yes. Bored and make decisions, absolutely. It's hard to, some people can feel really quite hopeless, and it can have those sort of cognitive effects as well about being hard to make decisions. Withdrawal, absolutely, William. Change in behaviour, yes, absolutely. Disrupted sleep. We've got withdrawal again. So yeah, lots of things coming up. Impaired pro-social skills, not being able to move forward in life. Absolutely. So it can have, quite a big ripple on effect. Thanks for those. I might move on just to sort of flesh out those a little bit further. So we can often kind of think about these things, the impacts of trauma, following these sort of 4 broader categories. And this isn't going to be an exclusive list, but can again give you a bit more of a flavour of what we might be talking about. So, and I guess another important point here is that the duration of these things coming up might be only short term. They might be days, they might be weeks, but for some people it can last longer. And not everyone who experiences a trauma will go on to develop a mental health disorder or, PTSD, that's post-traumatic stress disorder. So that's the sort of really acute kind of level of impact. And only 1 to 2% of people experience or would develop PTSD in a year. So again, just jumping into what it might look like. So people's thinking and cognitive capacity can be changed. So we said, problem solving, planning, decision making, concentrating, remembering things. You might notice that clients might forget appointments, or they might be coming up a day early or a day late. It's also important to recognize that people's worldview and their view of themselves can change after a trauma. So people might see the world as being more unsafe, or that other people can't be trusted. So, these are some of the things that might be coming out. We're also noticing that people can have physiological or physical or body changes. So we've mentioned, feeling anxious, angry, potentially feeling keyed up or on edge. People are actually also more likely to report aches and pains. So headaches, potentially feeling more jumpy. If there's like a loud noise in the background, their startle response might be more pronounced. Difficulty sleeping, we mentioned that as well. And some changes in behaviour. So that was also brought up in the chat. Thanks for that. So we're talking about people becoming withdrawn, maybe having more conflict with others, potentially engaging in more risk-taking behaviours, increasing their use of substances, so alcohol or other drugs. And also importantly, with one distinguishing feature of people who've experienced trauma is an avoidance of reminders of that trauma. So it might be avoiding reminders of people or places or various aspects that they might relate to the trauma. And we'll talk a little bit more about that in the next slide. But of course, we've also got to cover the emotional changes. We've talked about that hopelessness, that helplessness, anger, sadness, feeling fearful still. Guilt and shame are also really common. So maybe feeling guilty that, my house wasn't as badly affected after the fire as my neighbours, for example. And really those extreme emotions are quite common. So people can kind of report going from sort of 0 to 10 in, a really quick succession. And there's also things like panic attacks or, feelings of going out of control or going crazy. So that's what people can report. So overall, what does that look like for you? That aggression, that irritability, those extreme emotions, as I mentioned. Perhaps even physical threats to people themselves or to others. Perhaps it's difficulty explaining their situation or following instructions, particularly verbal instructions, or, that disorganization and forgetfulness. So these are some of the things that we can see. I mentioned sometimes people who've experienced trauma will want to avoid reminders of that trauma. And quite often there's a report that people will feel triggered. So this is really based on the effect that trauma can leave people in this really high alert mode, where really the body is on the lookout for any other sort of danger, any other threat. And encountering reminders of the trauma can activate this response. And as I mentioned before, these things don't necessarily always last, and more cases, more often they don't last, but they can, go on and be more prolonged if people's distress is more prolonged as well. So in particular, when we're thinking about triggers, we're talking about sights or sounds or smells, tastes, or maybe even sort of physical sensations that can remind people, and even sometimes sort of, particularly in the case of PTSD, bring people back to that incident. It's like being back there. And it's obviously a very intense experience. So trauma-informed care, the way in which we implement it, we can follow a number of principles, and there are 7 principles that can help guide your implementation. And again, these principles can be applied at either an individual level or an organizational level. So let's go through some of them now. The first principle is about being trauma aware. So this is really central to the delivery of TIC, and it's that understanding of what trauma is, its impacts, the range of events that might be experienced as traumatic, and the negative after effects. So all of that stuff that we sort of just covered. Having that lens with people with which you're working is really important. Again, you don't necessarily have to be sure. I understand in this context, you're going to be working with people who've experienced disaster, for example, but in your other work, you might be noticing people with some of these symptoms, and whilst not being sure, you can still tailor your approach to being receptive to the person and their needs. I guess another aspect of being trauma aware is also the sort of knock-on effect of the trauma. And so people can then experience, after having experienced a trauma, a number of major life stresses. So again, in the context of disaster, there might be a whole lot of property damage or complete property damage. There might be loss of community, loss of income. And these stresses can then further worsen people's mental health. So it's important to remember that they've got that other layer there as well. They've got the trauma, and then they've got the stress on top of that. Further to that, trauma can also lead to adversity. So, really referring to life events or circumstances that can result in a significant distress, or also maintain disadvantage or vulnerability. So when an individual experiences adverse circumstances, they're facing hardships or challenges which may not be traumatic, but they add to that cumulative load or that burden that also they have to maintain on a daily basis. So trauma-informed workers and organisations really need to incorporate this understanding into all aspects of their work, to help support trauma-impacted individuals and maybe communities. So when we're being trauma aware, we're really recognising the possibility of trauma, its potential impacts, and helps workers and organisations understand a service user's behaviours and tailor your work with them to better meet their needs. I also just want to make the point here, and I actually quite like the idea that trauma awareness encourages the question of what's happened to that person, as opposed to what's wrong with that person. And I think some of us, we can go into what's wrong with that person when we are met with some of those more challenging behaviours or more difficult emotions. But coming in with what's happened to that person is really a more compassionate and an empathic response. The second principle is about being culturally responsive. So I guess often when we use the term culture as being in relation to people's ethnicity or religion or race, The term culture refers to a set of beliefs or values or social practices held by a society or a community or a group. And culture can also be influenced by a number of other different forms of identity. So, for example, gender and sexual orientation, or activity limitations and participation restrictions, or political preference, or profession, or socioeconomic status, or location of residence. So there are a number of different things that people can identify with. And many people identify with more than one culture or group or community. So when we're being culturally responsive, we're being open to the culture of others, and we're recognizing that culture influences how an individual experiences, responds to, and recovers from trauma, and how they engage with the service. So again, just to sort of get the juices flowing, have a little bit of a think, and you don't necessarily have to put this in the chat, but start to have a think for yourself. Well, how do you define your cultural identity? How would you describe it? Perhaps some of these have been coming up in your thinking. You might also be aware that, the way in which we consider our own identity might change over time. Was this the same identity as you were thinking about 5 years ago? So the key point here is that, individuals define themselves and their cultural identity in many different ways, and that in trauma-informed care, it's not always possible to assume. Again, thinking about being culturally responsive, we also just, as I said, we don't want to assume, and we don't want to impose our own views about someone's cultural identity. We're letting them dictate what's important to them. So it's important to remember that cultures can also offer insights and wisdom and strength and support following a trauma. They can offer guidance regarding coping strategies and ways of healing and facilitating resilience. So when we talk about resilience, it's really that ability to sort of bounce back after a trauma. And being culturally responsive increases the likelihood that people from all cultural backgrounds and communities can engage safely and effectively with support systems. So at the end of the day, building cultural responsiveness is an ongoing and a collaborative process. So building safety and trust, that's the third principle. And when we think about most traumatic events, they do inherently involve some sort of threat to our physical or psychological safety. And, this can occur with disasters, it could occur with serious accidents, or even assaults. Others may also have had negative experiences when disclosing their experiences or seeking help. And so individual workers and organisations providing TIC really work to establish physical and psychological safety for those who've experienced trauma. And again, I want to here emphasise that staff should also feel safe at work and be supported to form trusting and respectful relationships, either amongst themselves or with service users. So again, I'm going to throw a question out to you all. How do you currently perhaps work with clients to help increase safety and trust? Just waiting for some comments to come in. Take time to listen. That's right, Isaac. Yeah. Active listening, great. And when we say active listening, it's often about, perhaps reiterating what other people have said to us, checking in that we've got a correct understanding. really engaging with that person by listening. We've got another one here. Explaining what needs to be done clearly. Yeah, absolutely. Absolutely. Actually, Daniel and I were just talking just before today's session started as well, and it's really about making sure you're clear with the client about what your role is, what you do, perhaps setting up clear expectations about what might happen during the process. It's about strengthening those relationships more broadly. It's about ensuring that interactions are respectful, providing that consistency. So again, not over promising and delivering what you say you'll deliver. Ensuring that environments feel safe and secure. I guess, that's quite inherent in the work that you do, but also, important to remember. And as we've sort of touched on, thinking about how someone might talk about their trauma and managing those discussions in a skillful way. I put a little asterisk there because that we go into a lot more detail about that in the course itself. But some people who've experienced trauma want to say a lot about what has happened. Other people don't want to say a lot at all. So you're kind of trying to find the right balance there for them, but also the right balance for you. So thinking about where you're at, what else is going on in your life, are you ready to hear that? And there are certain techniques that you can use to sort of help contain that conversation in a respectful way to both the other person and yourself. So here, really building safety and trust, we're remembering that every interaction is an opportunity to connect and to ensure that others feel valued and safe. Principle 4 is all about giving choice and control. So people who've experienced trauma, often they've never had control over those events, or they might have been forced to make terrible choices. They might have felt helpless. And, often, they're in those overwhelmingly frightening situations. So these are actually really powerful learning experiences and can result in trauma survivors feeling unable to voice their needs, or maybe fearful of voicing their needs, or taking steps to exert a sense of choice and control in their lives. So providing opportunities for service users to participate in planning and decision making, helping guide them through that depending on where they're at, that really counterbalances some of the effects of trauma. And again, thinking about where we can enact choice and control. It's not just in the work that we do directly with workers, with clients, but it also should be reflected in policies and procedures and the individual interactions as well. Again, a question to you. How can you give choice and control to enhance the work with individuals who've experienced trauma? Has anyone got any ideas or what you currently do? And I'll wait for some comments to come in if you feel comfortable. And then we'll go through some examples as well. Yeah, Angus, I'm just reading yours. Allowing them to set meeting intervals with gentle reminders if they're missed. Request feedback and open conversation. From Kylie. Don't jump in, allow space and time. Yeah, absolutely giving that control to them about that. Offer alternatives to choose from. Yeah, good. That's great, Salvador. I guess again, just to balance the idea about choice and control, being mindful of not giving too much choice as well. So we don't want to necessarily overwhelm people with information is what I'm saying. Yeah, so absolutely give choice and control. but consider the amount of decisions that people need to make in that one instance. Oh, Isaac, I like this one. Asking questions to the client to help them identify what's important to them in entering this process. Absolutely. That's sort of central to, why are they there? What, your role is to perhaps help them work that out, but in particular, help address what their needs are. Excellent. Okay, I'm going to move on. Thank you for everyone who contributed to that as well. So just some other ideas that we've got here. So, remembering that choice and control is really fostered when service users are encouraged to make those decisions and when their needs and preferences are taken into account. So yeah, we've definitely got that one. I guess another way in which we can help people feel in control is to sort of help them manage their emotions. Again, this is something that we go into in a bit more detail within the course itself. But, we mentioned that people can really feel out of control with their emotions, going from 0 to 10 in quick succession, or feeling like they're going crazy or feel out of control. So there are a number of really helpful calming strategies that you can support people to use if appropriate. They range from, suggesting, it's a simple exercise, which is often actually something that really drops off after disaster in particular. Or if in a session someone's getting distressed, hey, would you like to just go outside, get some fresh air, walk around the block? But there are other strategies that are more specifically targeted to reducing that physiological arousal, that anxiety, that stress, that perhaps those panic attacks that might come out. One is controlled breathing. So this is really about guiding that person to slow down their breathing, because by slowing down the breathing, it really helps that person's brain recognize that there is no danger, the threat is not there. Grounding is another one. So it's really about getting the person to kind of identify themselves in the here and now. So rather than sort of thinking about the past or worrying about the future, you're potentially guiding them through labeling things that they can see, things that they can hear, things that they can touch in the room. That can also help calm. And of course, there's a number of relaxation apps out there as well that you can support people to use, or maybe even use yourself. All of these strategies you can use yourself too. Principle 5 is about a focus on strength. So really we saw with that initial definition that trauma-informed care is a strengths-based framework for service delivery. And it's really based on the recognition that although individuals have experienced trauma and maybe experiencing difficulties as a result, they have survived and they have found ways to cope. They can be really resourceful and resilient, again, bouncing back. So, supporting them to draw on existing strengths and existing resources really supports improving their quality of life and also supports recovery from trauma. So, again, just to reiterate that key point there, it's remembering that service users are resourceful and resilient. Actually, I will go back again. I forgot to ask you, what do you think? How might you focus on strengths with clients? How do you already do it, or how might you plan to do it in the future? Maybe less of a straightforward one. Thanks, Isaac. Focus on the little wins. Yes, absolutely. The fact that they're looking into the future is a sign of strength. Absolutely, absolutely. I guess to break that down a little bit, often when we're faced with something really challenging, we see the very end and think, oh gosh, we've got to get through all of this to get there. But noticing each of those progressive steps along the way is so helpful. And as you said, Isaac, looking into the future is also a sign of strength, a sign that perhaps there's hope there and that hope for that recovery. Great answer. Thank you. I'll move on. So principle 6, as you got that little sneak preview of before, is all about facilitating connections. So remember thinking about the fact that, we as human beings, we exist in the context of relationships, and yet traumatic experiences can often involve violations of those relationships. And even when trauma occurs outside of those interpersonal relationships, they can often lead to subsequent fracturing of relationships or experience of interpersonal trauma. So, for example, there are really higher incidents of family violence after natural disasters. And as a result, people who've experienced trauma might find it hard to trust others. They might become socially withdrawn, as we've said, and isolated, and find it hard to engage with the kinds of relationships or the services that might actually be really helpful for their needs. So, we're wanting to sort of counter those effects. And the strongest predictor, the most consistent and strongest predictor for recovery after any traumatic event is connection. So trauma-informed workers and organisations really work to strengthen relationships, as we've said, and facilitate connections for those who've experienced trauma. And again, thinking about the work that you do, you might do this with clients, but you also might be doing this with your colleagues as well. Again, throwing the question out to you, any examples of what you currently do to facilitate connections with either your clients or with your colleagues? Have a bit of a think. Yeah, okay, yeah, sure, Isaac. We've reviewed the connections to memory through old photographs, yeah. So I guess that's connecting with a sort of a nicer time or connection with and shared stories. Nice, nice. So you're facilitating that connection with you by the sound of it, and which again, it's really helpful, even if one person has just one other person who's looking out for their interests, who's supporting them through it. That can mean the world. I'll jump into talking about some other ideas. So, there are a number of different ways that we can facilitate connection. And again, understanding that an individual's needs facilitates or guides where we're going to connect people to. And depending on people's needs, maybe they might be needing extra information, maybe they might be needing practical support. Do they have someone who can pick up the kids from school while they're coming to have a meeting with you? Have they got someone that they can talk to about how they're feeling and how they're coping? Or have they got someone where they just get that sense of companionship from? Also, in particular, with post-disaster recovery, that community connection is so important. So there's really strong evidence clearly indicating that community connections are vital to recovery and adaptation and resilience for the future. So again, connectedness is so important, and it really fosters recovery for trauma, from trauma, I should say. And finally, we're at the last principle. So this is a belief in recovery. Again, we've sort of touched on this. But of course, trauma can lead to people feeling hopeless or helpless or powerless. And they might find it hard to notice their own strengths or their own resources, or they might find they don't have the confidence in the capacity to solve problems and attain their goals. So when this does occur, people really find it hard to take an active role in their own well-being. But people do respond and recover to trauma in different ways. And a key element of the delivery of trauma-informed care is a belief in a person's ability to improve their own coping and quality of life and to recover from trauma. So trauma-informed service providers believe that things can be different and has the skills to help support people with that change. In the course itself, you will learn a little bit more about the different trajectories of recovery. So not everyone follows the same trajectory as post-disaster or post-trauma. But one key thing to remember for yourself, but perhaps to also communicate to the client that you're working with, is that most people will recover. And they will recover from drawing on their own coping resources or supports. Most people don't need specific professional support, but perhaps thinking about, going back to thinking about connection, if people are really quite distressed, perhaps guiding them towards their GP or a psychologist, if need be. And again, we can't assume that everyone recovers in the same way or at the same pace. So different people will need different types and levels of support at different times. So one more question about the principles over to you. How might you support recovery, or how do you support recovery with the people that you work with at the moment? Help identify a possible first step. Yes, nice, absolutely. I like that one as well. Making that first step can be the hardest part. So once you kind of step into that, then there's already progress made, and perhaps there's a bit more momentum with that ongoing recovery. Patient support, empathic listening and understanding. Yes, absolutely, absolutely. Connecting with people in that way in itself is supportive and encouraging. I like it. I've got a few other examples as well. Actually, I've got quite a big table here. And without being too overwhelmed here, I've just got two different columns here about sort of individual or ways, you as an architect working with a client can work with people and support recovery, even being non-judgmental and modeling tolerance or acceptance, being available to sort of support them with their recovery skills, like, identifying those steps that they've just made. And then also we've got this list of organizational strategies as well. So, perhaps ensuring that the design of support and service provision includes goals aimed at maintaining the well-being and supporting recovery. So there's lots of different things organizations can do. Again, this isn't a definitive or exhaustive list, but it can give you a bit of a flavor of what we're talking about here. Oh, and Sarah, I've just noticed your comment here. Accepting steps back are okay and expected. I like that. That's a really important thing. So, recovery is not a smooth trajectory either. So step backs are absolutely okay and expected. And people knowing that can feel less demoralized by them and more willing to sort of make those steps further into recovery. Thanks for that, Sarah. Okay, so we've got about 9 minutes. I just thought it might also be really, just for a couple of minutes, might be useful to think about a particular case study. Here, this is the Thompsons. I'll go through it quite quickly, but just so imagine that you're collaborating with the Thompsons, a family profoundly impacted by a recent bushfire. Mr. Thompson, a frontline worker, and Mrs. Thompson and their 2 children had to flee the path of the bushfire. Like many in their community, they lost their home in the disaster, and are currently residing in temporary accommodation. So as an architect, you're challenged by the balance between the technical requirements of post-disaster reconstruction and an empathic understanding of trauma and the way it impacts the Thompsons' mental health. Mr. Thompson is often angry and frustrated, and Mrs. Thompson is struggling to articulate her needs and preferences for the rebuilt home. It becomes clear that the family is facing not only logistical challenges, but also profound emotional distress. So your role is to create a design that not only meets the structural standards, but also considers the Thompsons' emotional well-being. So have a little bit of a think based on those 7 principles that we just went through. How might you just apply one of those principles with the Thompsons? Have a little bit of a think, what comes to mind in the first instance? Again, just to get the juices rolling. And perhaps I might get you to write just a little brief answer in the Q&A, and I'll select just one of them to go through. Thanks, Courtney. I might take yours just first cab off the rank. So ensure that both Mr. and Mrs. Thompson are available at meetings. Also provide options for the designs. Yeah, sure. So getting that collaboration, I guess that connection with the both of them, and the options for the designs is very much tapping into that sort of that choice and control. I like it. I can see there are a few others coming in. I won't have time to go through them, but starting to think about those principles in a kind of an authentic-ish, hopefully, scenario can help you start to think about how you might be able to apply those principles in your own work. So we're reaching the end of today. So as we've learnt, TIC is that strengths-based framework that's grounded in an understanding of and a responsiveness to the impact of trauma. It emphasises the physical, psychological and emotional safety for both providers and survivors, and creates opportunities for survivors to rebuild their sense of control and empowerment. So those 7 principles you might see really, are really captured in a lot of this summary, and hopefully you're starting to think about how you are already and perhaps how you can continue to implement these principles in the work that you do, the amazing work that you do. I do also, again, just want to highlight this online course that I know you're all going to be completing, or maybe have already started. So it's an online 6-hour self-paced learning course. It's modular in structure, so it allows you to dip in and out when time is short. And you can go, once you've completed it, you can go back into the course to reinforce your understanding. This course also has active learning scenarios. So again, to help you link that academic content with real world examples. One other really brief thing that I do want to highlight to you, this is outside of TIC, but what might be really helpful for you is this disaster mental health hub. So it's got a whole lot of information and resources for people working with individuals or communities after disaster. So thank you very much for your time. I will be happy to take some more questions in these last few minutes.
Thank you so much, Anna. That was absolutely brilliant. And I think a lot of those questions along the way were really helpful to get people starting to think about what happens in their own practice and how they can engage with people who might have experienced some form of trauma in their practice. We only have a few minutes left, so I might start off with a couple of questions that I have. And this might also lead into some of the things that we discussed before the session today. So regarding the stresses that you mentioned, if an architect has recognized that a client has continued stresses through their architectural process, how might they manage working with that client? How do you think they might go through that management process with the client if their standard architectural service is basically making their client feel stressed?
Yeah. I mean, I think, again, Daniel, as you and I discussed at the start, setting up those expectations at the start is really super important. Knowing that things, what they might expect can kind of lower some of the stress in the first place, and also lower the stress when, perhaps those additional things that perhaps it sounds like quite inevitably do come up, they're not as much of a shock. And I guess remembering sort of from a trauma perspective, people are already heightened, so and their tank is already full. So an extra stressor can kind of bring that to being at a point of where things are feeling quite overwhelming. Excuse me. But then again, some of those strategies that we use to help calm people, they're not just useful in the case of trauma. They're, of course, useful in stressful situations as well. So, getting people to going, hey, how are you going with your stress? Some things that other clients might find helpful is to go for a bit of a walk, or I find it useful to just do some controlled breathing, and this is the app that I use, or providing those options for them, not necessarily in a directive way, but sort of putting that platter out there so they can then choose what they feel they want to use. And finally, I think that connection, again, going back to connection as being super, super important, both for recovery after trauma, but also, support with stresses and all those major life stresses that can come up. That connection with you, or encouraging, connection with loved ones or families, that can also really bolster people's resilience. Yeah.
Yeah, no, I like that. I think some of the suggestions about what people can incorporate into their just daily lives that might help them lower those stresses, whether it's controlled breathing or exercise even. Those things are really helpful. And I guess if you're starting to develop this relationship with your client where you can open up naturally about that, then that's really, really great way to help them through that. We did have one question about people working with young children. So one of our members who is working on a preschool where some of the students are experiencing trauma. Do you have any comments about ways that architects might be able to adjust how they work if they know that the end user, or during that consultation period, they might be coming across younger people who've experienced trauma?
Yeah, I guess, kids are also can really obviously get the impact of trauma on them, as we said, either with domestic violence, or from the initial trauma themselves. Quite often you might notice that children are more likely to be talking about tummy aches or sort of physical symptoms. But again, connecting with them, connecting through play. Even young kids can be fairly responsive to, practicing breathing, and, again, some of those strategies that we might use as adults, depending on the age of the child, they might be quite receptive to that. So yeah, again, there's lots of things that we can do with children to help support them. Yeah.
Right. Well, that's all the time we have for in terms of our questions, everyone. So thank you so much for being so wonderful and participating with Anna today. And Anna, thank you so much for your presentation. It was so great. And I, yeah, would
Sure.
highly encourage all of our members to undertake the trauma-informed care that training that Phoenix offers for us. So you can find that through our CPD channels and through also our communications that we send out through Architects Assist. So yeah, the Bureau of Meteorology has forecast a serious bushfire season this year, and we've also seen cyclones and floods. So please remember to contact your clients and ask them about their preparation plans regarding the beautiful projects that you've designed for them all around Australia. Being forewarned is forearmed, so please contact your clients to make sure they're ready for the forecasted conditions in their area this season. It's now mandatory to complete the course in trauma-informed care to remain with Architects Assist. So we are hosting another lean-in session, or we did host one last week with regards to bushfire design and client engagement that is now available on our YouTube channel. So just a reminder that these lean-ins are recorded. This session will be available in a few days once it's been edited, and you can find that on the Australian Institute of Architects YouTube channel via just YouTube. Just search YouTube at Oz Architects and you'll be able to find our channel there. So thank you so much for Anna for joining us today. It was really fantastic. And thank you so much to everyone joining us around Australia. I wish you all a very pleasant afternoon. Thanks again.